Hey everyone, my name is Samantha Riddle. I'm an RN. I've been an RN for about 4 years now. I'm currently employed on a 21-bed medical surgical unit. I'm also enrolled in an RN to BSN program through UNCW. And recently, in one of my classes, I participated in a collegiate level debate. We just debated in our group a piece of legislation that was in front of the North Carolina at the moment. The bill that, or the piece of legislation, the bill that my group chose to debate was the S779 North Carolina Telemedicine Practice Act. We chose this act because we felt like it was something that we all are dealing with, is this telemedicine. It's not brand new, but it's new and it's getting bigger in healthcare. So we figured that we could kind of learn something for it for our own practices, and that we would be able to debate for and against pretty easily. This piece of legislation has actually been referred to the Committee on Rules and Operations of the Senate of North Carolina, which basically means there's a few more steps that it needs to pass through before it becomes a law, or that it could completely die and never become law. And that's where we're at with it. When we were debating this, there was a few things that really stuck out in my mind about this bill, that made me say, hey, I'm for that bill, and hey, I'm against that bill. The one thing for that bill was the standard of care that it's going to have providers adhere to. It makes sure that the patients are getting the same standard of care as if that provider was face-to-face. It makes sure the standard of care that the people using the technology is able to provide is the same as the face-to-face contact. So that was the big thing that was like, yes, this is great. We need to move forward with this. Sign it now. The one piece of information in the bill that I wasn't too keen on and made me step back and say, wait, hold on, I don't know about this, was there's a piece written there that providers are able to use assessments of others that are in with the patient. So if I'm in with that patient and I do an assessment and I'm using a telemedicine doctor to see that patient with me, they would be allowed to use my assessment to help with their diagnosis. And that was the one piece of con or against for this bill that kind of stuck out in my head. This bill has a lot of implication for nurses. You know, it's backing us as nurses and as other staff in the medical field, that it's going to make sure that we get the education needed to use the telemedicine, whether it's a stethoscope on our end and the doctor on the other side, or the computer system that's with the technology. You know, it is going to force our hospitals or providers to make sure we've got this technology down, and that is a great thing. And I think that's going to be super beneficial for RNs to use this service. This act also wants to bring telemedicine and medicine to more rural areas, so that patients that are not able to travel in to see a doctor or have the ability to see a doctor. They have the ability to get their test results and lab results to those physicians so that they can look at, so that their health is more well managed, instead of just sporadically, oh, I haven't been to the doctor in 6 months and the reason why is because I can't get there. Or I was able to see a specialist sooner because they could use the telemedicine service. So I think that it's a great thing, and that this bill will push for that. I personally think this bill needs to be passed. I am for this bill. When reading through it, there was many great points to this bill, but I also feel that this bill needs to stay where it's at for the moment, and that some clarification needs to be added to this bill. Clarification as to what happens when we have upgrades to the technology of this bill. What would we do then? What if the system's down? What do we do then? Things like that. Also, the assessment for me needs to be cleared up a little bit more. Just I think it's great that they want to use my assessment. It's not that I feel weak in my assessment area. It's just that, the first thing that you do is, or I do as a nurse, I guess, is that somebody, especially as a charge nurse, somebody tells me a patient's going downhill, something's happening, they've changed dramatically. I want to lay eyes on that patient and do my assessment for myself. So if they could just tease that out a little bit more, and maybe reword it as to, so that maybe we don't feel like our assessment is going to completely base this medical diagnosis. I think that it would be a great bill then, and then it could pass forward. Thanks for listening. Hope you guys have a good night and have fun doing this, and I'll talk to you later.